Well, at the state capitol tonight, hospital staffing is in the spotlight. It's part of a bill being debated on the Senate floor. Chief political reporter John Croman is live with all of today's action. Hi, John.
Hey, Rena, you know, the nurses have been talking about staffing forever, but they're not asking anymore for hard and fast ratios, as in certain number of patients per nurse. What they're asking for is to be on the committees that make those decisions. And that was part of the big Health and Human Services bill debated here today.
Hospital nurses making themselves heard outside the Senate chamber on a pivotal day in the long journey to tackling patient loads.
And nurses have been saying over and over again that they want to take care of patients. They want to do it safely.
Tears for DFL State Senator Erin Murphy, a registered nurse and nursing educator who appeared with union nurses before heading to the Senate floor.
Give them the tools to make sure they can practice nursing with the skill and the dignity and the professionalism and the excellence that we want for Minnesotans across the state.
The Health and Human Services bill would require nurses make up at least 35% of workplace committees that set the schedules and minimum patient loads for each hospital unit.
It is giving us a seat at the table to be able to professionally do what we have a right to do, and that's to advocate for our patients.
Hospitals are opposed to the idea, asserting that it will drive up costs and lower the number of patients they can serve, a point made during the Senate debate by Park Rapids Republican Paul Utke.
This bill will dramatically increase health care costs. Hospitals will be paying for all their employees to serve on the various staffing and workload committees. And in the meantime, those shifts will need to be covered by other hospital care professionals.
Republicans instead want Minnesota to join an interstate licensing compact.
People who are already trained and licensed in other states can move to Minnesota and not have to go through the complex licensure hurdles to do a job.
That Republican amendment did not make it onto the bill after Democrats argued that the problem isn't getting nurses to move to Minnesota. The problem is getting nurses to stay in those hospital jobs once they are hired. Now, that bill passed in the last half hour with just one Republican joining all 34 Democrats voting in favor. It still is pending over in the House. Back to you.